Thanks for staying with us. For more on our top stories and others, please visit our website. It's channelstv.com and on youtube.com/channelsweb. You can watch us on the go on your mobile device. Log on to m.channelstv.com or download the Channels TV app for Android, iOS and Windows devices from their respective stores. Having the Channels TV and Channels 24 app will give you access to news and updates. You also have the Eyewitness feature, so you too can be part of the news. Just install the app, then tap and swipe to reveal the Eyewitness menu and follow the instructions to share those pictures, videos or news of happenings around you. Today is World Mental Health Day, and every year on October the 10th, the attention of the world is turned towards the importance of mental health. This year's theme is Mental Health in the Workplace, and the Regional Director of the World Health Organization, Mashido Moeti, in a message to mark the day, established that mental health is often neglected as a key aspect of employee health. Globally, an estimated 10% of the employed population has taken time off work due to depression, and an average of 36 workdays are lost when a worker gets depressed. In Africa, lack of information and cultural issues are significant barriers that prevent people from getting help. And still talking health matters, the head of the World Bank Africa Initiative, Professor Kamarogo, says the African continent has the largest burden of diseases in the world and the lowest in healthcare delivery to its people. He made this observation in Ilorin, the Kwara State capital, during a courtesy visit to the State Governor, Abdul Fattah Ahmed, at the Government House. Governor Ahmed dropped a hint about the community health services, which are affordable to residents in Kwara State through the Community Health Insurance Scheme. The British authorities have assured the Nigerian government that it will help the country in containing the monkeypox disease and other related health issues. The British Deputy High Commissioner to Nigeria stated this while on a visit to Kwara State branch of the Federation of Women Lawyers, which is in Ilorin. She mentioned that all hands have to be on deck to contain the disease, which is now in 6 states.
The British government is supporting the government of Nigeria in addressing health and education and basic services in general to ensure that the health of the population here goes from strength to strength. We're monitoring the situation very closely with the World Health Organization, and we'll be reviewing our support as and when we go. We will be monitoring the situation very closely. As it stands, we provide through the Department for International Development about 400 million pounds in aid every year to Nigeria in support of poverty reduction, health and education. Our support is wide and broad and deep. Of course, we cannot respond to every priority, and I hope that the government itself, as well as the state governments, will take responsibility and invest in health solutions to protect our people.
Rivers, Ekiti, Akwa Ibom, Lagos State, in addition to Bayelsa, where it all began from, making it a total of 6 states with confirmed cases of the monkeypox disease. Today on the program, we're being joined by the Chief Executive Officer of the Nigerian Center for Disease Control, Dr. Chikwe Ihekweazu. He joins us from our Abuja studios to discuss more about this disease. Thank you so much for joining us. The rate at which this disease is spreading is alarming. First it was Bayelsa, now we have Akwa Ibom and 4 other states. So what is your agency doing to control this?
Okay, thanks. I've lost audio, but I think the first thing to say is that this cluster of suspected monkeypox cases started in Bayelsa State. We haven't at the moment confirmed any of the cases. It's a very rare disease, so the tests for this disease are not readily available. We're doing everything possible to have a confirmation, and the samples have been sent both to our reference lab in Nigeria, to also the WHO reference lab in Dakar. So everything possible is being done to confirm the cases. Now, the other thing is there are many things that cause a skin rash. And what I think we're seeing is that every possible case of a significant skin rash across the country is being reported. So we want to tell people to please do consider the full range of differential diagnosis that can cause a skin rash. Not every skin rash in all the states will turn out to be monkeypox, but our responsibility as an agency of the Federal Ministry of Health is to ensure that every single case is investigated and we can rule in or rule out monkeypox. So at the moment, if you see the press release, it says suspected cases, we're still investigating, and as soon as we have further clarification and further confirmation of the cases, we will be the first to inform Nigerians.
So these other states are being mentioned. There's no confirmation yet that those are actually cases of monkeypox.
And that's the point we want to make. There's no confirmation. There's no reason for panic either. And even if any of the cases will be confirmed, I've said severally, this disease looks a lot worse than it is. Even in the cases in Bayelsa, all the patients are doing well. There haven't been any deaths. Most of them have been discharged and have gone home. There are few cases left in hospital, so there's really no need for panic. We're working very hard with our colleagues in the state governments to get the confirmation, get the samples taken, get confirmation as quickly as possible. So we want to assure Nigerians to please go ahead with business as usual. There are a lot of the images and language being circulated are not true. We're doing everything possible to confirm this outbreak and respond as necessary. Many of the cases that we're seeing across the country could well be something else, and it's probably most likely that they are.
Now, talking about the response, what should be the immediate response to the disease, especially for people in rural communities, in order to curb the further spread?
Yes, I think the key message will be, but you see, the Federal Ministry of Health and the Honorable Minister have been emphasizing over the last few years strengthening primary health care across the country. We can't have good surveillance without a good primary health care sector. The same message, many states have been investing in their primary health care services. So what we're telling people is, please, if you find that you have any symptoms, a rash on your palms, on your face, that you think this can be small monkeypox, please immediately go to your healthcare facility. Don't try and treat at home. Don't try and manage at home. Go to your healthcare facility, and they know exactly what to do, because we have educated all the states across the country exactly what to do when they find a case that fits the case definition, and we will take it from there. So have confidence in your primary healthcare centers. Not all of them are where we want them to be, but this has been the focus of the Honorable Minister of Health, to improve primary health care so that Nigerians can have confidence in their healthcare delivery architecture.
Dr. Hekwadze, in a situation where a patient is down with, say, malaria or typhoid and then contracts this disease, could it worsen the patient's condition?
Of course, when anyone has a couple of infections is co-infected, it can worsen it. But, remember, both diseases you mentioned, there are treatments available. No one should die of malaria in Nigeria because there's a rapid test and there's treatment. The key thing, like we're doing with all public health infectious diseases, please come to your healthcare facility, get a test. There's a very good test for malaria. Once it's ruled in, we can treat. If it's not malaria, we can look for something else. So the key thing really is the era of self-medication is over. If you have symptoms, go to your healthcare facility. They'll manage you appropriately, test you, and provide you care. If it's something that requires a public health intervention, they know to inform the local government, disease surveillance, and notification officers, who will then take it up the cascade from the states to the Nigeria Center for Disease Control. For this specific outbreak, we have set up an emergency operations center to coordinate the response across the country. So every state that needs support and needs help or needs where to send the samples, we're there at the Nigeria Center for Disease Control to support the states through this process.
Thank you so much, Dr. Chikwe Ihekweazu, for joining us on the program. He's the Chief Executive Officer of the Nigerian Center for Disease Control. He spoke to us from our Abuja studios. And coming up after the break, the National Drug Law Enforcement Agency destroys a cannabis farm in Osun State. Join us again.